Hello, hello. Welcome to the Mother Daze podcast. I'm your host, Sarah Wright Olson.
And I'm Teresa Palmer. Yeah.
Hi, Daisies. Oh, buddy, we have a fun episode for you guys today because we've been talking about this for a while. We had a couple of episodes here where we were like, we really need to get my doctor on so that we can talk all things birth. And so we are so excited today to have Dr. Melissa Drake and the amazing doula, Anastasia Stone, on our podcast. Thank you guys so much for being here today. Woohoo.
Oh my goodness. We are so glad to be here.
I cannot wait. I cannot wait to unpack this birth with you guys. So good. I've seen like little snippet. I've obviously heard the full birth story, but I've also seen you guys both in action on video. And it's amazing.
The video that I can't put online because it's just my bum hole the whole time, basically.
Yes, a bum hole.
And some people don't mind that, you know. Some people don't mind their bum hole just like being exposed, but I do. It's like the maybe one thing I want to protect.
Sarah,
I can't even.
Very flexible. I mean, is she not so flexible? I was like,
Yes.
The video with the legs straight up in the air. I was like, what is happening? Are you a ballerina? What is going on?
No, not at all. But when someone tells me to do something, I do it. That's the personality type.
It was.
That's my personality type. Well, you guys have heard a little bit of the story of how when after the fires, I came to this new town and my friend had birthed with this amazing doctor and I'd heard her story and we'd had her on the podcast and this amazing doula and we became friends, the doula, Anastasia and I. Now I can say your name because you're here. Anastasia and I became friends and then it was like we were up here. The fires had happened like just a few days before and I had made a joke like a year before where I was like, oh, maybe one day I'll have my next baby with you guys, you know? And then we were like, oh, ha, 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 if I ever move up to Santa Barbara. Well, it turns out I did. And
you were how far along at this point?
Around the fires? I think at this point I was up. Like 5 months maybe, or was I don't know. See, October, November, December, January. Yeah, like 5 months, 6 months. So I saw Anastasia and then I was reintroduced to Dr. Melissa and then we were on this chat thread and they're like, we're your team. We've got your back. And I was like fully in tears, just like, thank you guys so much because so much in our lives had changed at this point. And so much was feeling scary. But the one thing that I really wanted to feel good about was like, okay, if I can just get everything settled for this baby, then we can put all the other pieces in place. So anyway, I just have to say like so much gratitude for the both of you for making me feel so safe and so supported and just loved in this crazy time in our lives. Before we get started, I just wanted to say that. So thank you guys. And from the bottom of my heart. And then even more so, like after everything that happened, oh my gosh, my husband was like, I love them both so much. I was like, I know, me too.
Well, it was like definitely divine or so divinely orchestrated because I think back and I'm like, my gosh, we met 2 years before that.
Yep.
And you and I were at that party in the corner and talking to no one else but each other.
Wow. I know. We were just talking birth. Talking birth, babies.
Yeah. The whole time. And I was like, oh my gosh. And I remember going,
You told me about
I did.
Yes.
I was like, oh my gosh, Melissa, I met Sarah and she's so sweet. And we just talked the whole time. We didn't care who else was there.
Yeah.
Yeah.
You're basically like, I made a friend. And I was like, how nice.
And of course it's about birth. Like, that's so beautifully Sarah. Like if anyone wants to sit down and talk to her about birth or babies or pregnancy, she's like, I'm ready. This
I'm
is
ready.
my vibes.
Just vibes. Also our vibes.
Yeah.
So.
Yes, good.
That's exactly right. Well, I would love to hear, Dr. Melissa, you've told me some of your story, but I'd love for you to tell us a little bit about how you got into this work. Like, your approach to everything is really different than some of the OB-GYNs that I've met in the past. And I know that it's not even where you sort of started off wanting to go into. So, like, can you tell us a little bit about that?
Yeah. So that's the funny thing is, like, I originally thought I was going to be a dermatologist when I went to medical school. I was like, I think I like to sleep a lot. I just don't think that, like, the whole lifestyle of OB-GYN is going to work for me. This whole being up a lot at night thing. I think dermatology is the way to go. Fascinated by skin. And then, your third year of medical school hit, and, we started doing rotations and things. And I actually set up OB-GYN as one of my first rotations, because the way you do that is you're supposed to set up the ones you think you're not going to be good at first.
Oh, wow.
And the ones that you think you're not going to like, you're supposed to put those ones first, because you're like, I'm going to be super green and really bad at this stuff, so I'm going to do that first and get it out of the way.
Wow.
So I did OB first because I'm like, I don't think I'm going to like it, and I'm going to be really green. And I did it first and loved it. I was just obsessed. I fell in love with it. As I think birth workers tend to do, like, if you're a natural birth worker, when you first start to engage with birth, you just sort of fall for it.
Yeah.
And it's so magical that you're just like, well, I found my calling.
Yeah.
Heaven. I think of it almost like the priesthood. Like, when I talk to medical students and stuff like that, and, like, you really have to have a calling for it. You cannot, a lot of people are like, so what's it like with this? And how's this? I'm like, you have got to find a calling for it. And I really did. So that's kind of how I fell into it. I found a complete love for it. Went to the East Coast for my residency. I went to Washington, D.C. I'm originally from Tucson, Arizona. That's where I grew up. I went to medical school there. Went to Washington, D.C. for my residency. And I went to GW, which is George Washington University. It's a super intense, really, surgically focused and very, it's an intense residency program. And one of the things that's unique about it is they had an in-house midwifery program, Wisdom Midwifery. And so we got to see some midwifery birth, and we served as residents as, like, the medical backup for the midwives.
Oh, cool. Wow.
But even within the program, there was still a little bit of like friction there. It wasn't like all the docs were super welcoming to it. And the way I was trained was really old school allopathic, like, do a cervix check every 2 hours and, like, write it down and write a note kind of labor.
Interesting.
Like, that is not how I practice anymore at all.
Yeah.
Which is, like, hysterical.
I was, like, begging for checks. I was like, can you check me? I need to know where I am. Like, I'm a control freak.
I have the brain to know these things. So, like, I was trained in that, and then I left. I came out to Santa Barbara because my husband got a job out here. My husband's a fertility doctor.
Yeah.
Oh, wow. And what a pair.
So he got a job out here in Santa Barbara, and I came out here and, set up my own practice here, and realized, as I started to find my footing as a private practice physician, that I don't practice the way I was really trained, in that really kind of old school kind of way.
Yeah.
I'm just different. And I am friends with, all of my friends are midwives and doulas.
Yeah.
And I really learned how to be a better physician, really, from the patients, and really from them, and just from reading and from being, experiencing more and more birth, and realizing that, like, birth doesn't have to be so medical.
Yeah.
And so, I still carry all that allopathic training with me. I do surgery. I can do surgical rescue. I can do, cesarean very, very well and very easily, and those kind of things. And, when emergencies arise, I can jump into action and handle things. But in general, I don't like to do a lot of medical intervention for pregnancy and birth. So.
Wow. You're amazing. A dream.
Well, I loved watching you during some of the videos that I saw, because obviously I was not aware of like what was happening around me during birth. But when you talk about like, you know, a traditional way of practicing, I guess, or I would say traditional because that's the word that I can use. But you were sort of like kind of sitting back, watching everything, taking notes. Like it just felt like your presence was so gentle and just there, and you were like holding the space. And when I would look, you would, you know, you were like sitting and your head was kind of to the side and you were like watching and just, you were just, I don't know, it's like an amazing presence. And a lot of times I feel like you see doctors like kind of pop in at the end and they're like, okay, I'm here, put my gloves on me. And then, you know, it's it's like we're at this point, you know, and they're going to swoop in, and you were just there every step of the way, which was so unique and beautiful. And
you were so validating.
Yes,
like the
so
first thing you said to Sarah, like after the baby came out, you were like, that was a hard birth, Sarah. That was a hard birth. Like you really acknowledged what she had just been through. So because she would have felt shell-shocked. I mean, that was such a wild experience, and you really acknowledged her, and it was done in such a loving, kind way that I said to Sarah, like, that was one of the most poignant moments for me, was just the acknowledgement of what she had just been through. It was gorgeous. It was so beautiful.
Well, thanks. I mean, like, I find it's like so important to like, just like take that moment, you know, and just be like, my God, like what you've just been through, like, really bring you to yourself. I don't know if that makes sense.
It totally does. I mean, and I would never forget that, because that's when you're saying that, I was like, yeah, that was hard. I mean, that was tough. I had like a previous birth, and I know that the very first thing out of my mouth after birth with Winter, and this was like my COVID birth, the very first thing that I said was, that was hard.
Yes, I've seen that video. That was so hard.
That was so hard.
Little did you know, the next one would be a lot harder.
That's right. Oh, I thought that one was hard. Well,
but like, you did so incredibly. I just wanted to be like, do you know what you just did? That was so amazing.
Oh, that's so nice. Well, Anastasia, tell us a little bit about how you found your way into doula work. And then I want to know how you guys got together.
Yeah.
Because you're such an amazing team.
Yeah.
How did we find each other?
How did you find each other?
So the way I got into birth work was, gosh, I guess it was, I have to think of it and how old my kids are. So like 16 years ago, I was just doing some work with moms that were like single or in crisis. And so every once in a while, I would find myself at a birth with them if no one was going, or if it was like an 18-year-old boyfriend or something. I'm like, oh gosh, someone else should be there.
Yeah. True. Okay.
Yeah. So at the time I lived in Santa Cruz, which is really similar to here. It's a pretty small town. Everybody knows each other. You walk into the hospital, you know, you're all doing life together. Mm-hmm. And I just kind of felt like, oh, I wish I had a little more tools. Like, I know I'm okay. I've had a baby before, but I just wish I had some more tools. So I went and got training 15 years ago. When my second was about 1.5 years old, and everyone found out and then just started saying like, oh, you should have Anastasia go with you to your birth. So before I even finished my training, I was already set up to go to my really good friend's sister-in-law's birth. Yeah. And so then it just kind of took off from there and was like slow and steady, because I have 5 kids. So that was only number 2.
Wow. Do you?
Yes. Twins at the end. And so it was
my dream.
So it kind of ebbed and flowed of like how many births I was taking, but I did some midwifery assisting too. And I knew some of the midwives in Santa Cruz and hung out with them. And Dr. Drake and I unknowingly moved to Santa Barbara at literally the exact same time.
No.
Yep.
Oh, that's so cool.
Right?
Did we really?
I think it was the same.
That's hysterical.
Or it was like a month here. It was ridiculous.
Wow.
So my husband grew up here. So I'm moving here and I like know people already. My mother-in-law has been a nurse here forever. And I had twins that were a year and a half old. Wow. And so I was like, well, I'm not going to do the on-call thing at first. So I didn't. And this will lead straight into our story. So it's perfect. But, I was doing other work and I was doing advocacy work, but I was like, I can't be on call. These guys are just too little and it's too much. And we just moved. And so I waited for a while, but I did like one of my doula clients from Santa Cruz happened to move down here. So I did her birth. And then I had a friend call me and she was like, I have this friend and she's like moving here. Can you do her? I'm like, yeah, I'll do that. But it was very one-off-ish. But when I was doing advocacy work, I was with these other leaders and they were like, well, one of the ways we would get to know the doctors in town is we just made appointments for annuals and then asked them questions about their philosophy. And I was like, oh, I haven't had an annual. So I just Googled like doctors in Santa Barbara and I see Melissa's picture and I'm like, oh, she's kind of young. I'll try her.
Oh my gosh, you're joking. It was a Google? You Googled?
Wow.
Wow.
I read her bio and I was like, she sounds kind of cool. All right. So I make an appointment. So I'm literally like sitting in the thing.
Oh my God.
Oh my God. While she's got her hands up your vagina doing your annual check. You're like, hey, so I have a few questions for you.
So are you looking for a doula friend? Yeah.
Tell me about your philosophy on this.
So I'm like legs in stirrups.
Oh my God.
Extremely interested in my philosophy.
No, but you were so comfortable. Well, yeah. We just start talking and and she's asking me about my birth and then I'm talking to her about VBACs and she's like, oh yeah, well, it just turned into this conversation. She goes, oh yeah, we did them in, this was my like memory of her that like stuck with me. We did them, I did them at George Washington, but we would put an epidural catheter like in every single VBAC patient. They didn't have to get the medicine, but they had it placed. And I was like, I sometimes cannot pause.
No filter, huh?
I no filter. And I was like, really? I was like, we didn't do that in Santa Cruz at all. Nobody did that. And but her response was, oh, really? Tell me about it. And then we talked about it. And I was like, oh, she's different. So that was kind of like the first run-in. And then I was doing these random one-off births. And so I would tell everyone to go to her.
Yeah.
And then we were like, doing different things. Anyways, it just basically ebbed and flowed into one day. She ended up with my cell phone number. And I ended up with hers. And then we had breakfast. And then she started handing out my phone number. And I texted her and I was like, I didn't tell you I was taking clients again. And she was I was like, okay. And yeah, here I am.
And then you did.
Sorry, your business exploded.
Oh my God. That's so good.
So now we do a lot of life together.
Oh my goodness. Meant to be.
Yeah. Yeah.
I mean, but it's that's so genius though. Could you imagine like, if every town had an amazing doctor with a doula bestie that was gonna like be a partnership and come to your birth, and that's so amazing.
It's a proper dream. It's very unique. Have you guys met other people who have kind of a similar setup to you?
Not really.
No.
And so it works that you're independent. So you're independent of the hospital, but then you have a relationship with a particular hospital, which is the Santa Barbara hospital.
Yeah. Here in Santa Barbara, there's only one hospital that has a maternity unit. So there's 2 hospitals in the city proper, but only one hospital that has a maternity unit. So that's the hospital that I have hospital privileges at.
Wow.
Yeah.
So it's not like a bigger town where there's like the LA doctors will have like 2 hospitals.
Well, I was so impressed to hear that you were coming over to Sarah's house and you were doing checks and you were making sure she was feeling good and she had the blood clot in her arm. And I was like, wait, your doctor, your OB-GYN is coming to your house for like appointments and stuff. This is so what kind of unique, incredible opportunity is this? Like that's unbelievable. That's a dream.
I did say that I think the way that you sort of run your practice is similar to the way that like midwifery care would be, where you're like coming to someone's home versus them always coming to an office, or, you know, there's like follow-up care and stuff like that, right?
Okay. For sure. I used to have the single busiest practice in Santa Barbara. So I used to have a super like a traditional brick and mortar office with, I think I had 8 staff members, and I was delivering at the height of my practice. My craziest month, I had 42 births that I delivered completely alone.
It's so insane.
But a more average month, like an average month would be 30 to 32.
What?
So like that was my average month, was like 30. I never did less than a month.
That is unbelievable. Same.
Like, without a partner and without a call group. And so that comes out to like, you know, 20 to 25 patient appointments a day. I had an amazing certified nurse midwife who worked with me, Jessica Thrift. She was awesome. And so that allowed me to, you know, see the patients potentially dash out in the middle of the morning to like go across the street to do a birth. But when you do that like that, I mean, I did that for 5 years or so. I did it for a long time. And that's like more than one delivery a day, 20 to 25 patient appointments a day, rounding in the hospital in the morning, rounding at the hospital at lunchtime, rounding after the office ends. It just like takes a toll on your body physically.
Yeah, of course.
Drinking 6 coffees a day and one of those like white Monster energy drinks and like living with carbs and cortisol. It just like takes a massive toll on your body physically. And I had a big health scare. So I had to close my practice.
Wow.
And I had to just like take a break and heal. And when I reopened, because, you know, I was like, I can't, again, calling, I was like, I have to do this for my life. I can't not do this work.
Yeah.
When I reopened, I was like, I want to do this in a way that is sustainable for my lifespan.
That's
like,
right.
I want to be able to do this because the average age at which most OBs will stop delivering and transition to pure GYN practice is like, I think like 52. Like most doctors will not deliver babies post that age.
Wow.
And I was like, I want to do this like into my like 80s. I don't know. I want to do this for my whole life. And so I thought, who does this the right way? And I thought about the midwives because they always do stuff the right way, pretty much. I was like, they're the keepers of the flame. They know how to do stuff. And they won't take more than 5 deliveries a month usually. Like, it's, you know, they know that that's plenty when you're doing care properly. So when I reopened, I said, I'm going to sort of learn how to say no for once in my life. I'm going to take 5 deliveries a month and I'm going to totally change the way I do this and do all house calls. I'm not really going to have a proper office anymore. I'm going to go to the patient rather than having the patient come to me. I'm going to let the visits last for as long as they need to. The visits are going to be, you know, sort of just like sitting and talking to a girlfriend, except your girlfriend is a trained medical professional. Yes. And I'll have my little checklist of things that need to get done in the back of my head, except, you know, for the most part, we're just going to be talking. And it's really worked out. It's really felt like the way care really should be provided. And it makes sense because, again, the midwives have been doing it that way for a really long time. So I owe a lot to them in terms of that side.
I love that kind of intimacy, like being able to like go into someone's home and like have that kind of friendship and that dynamic. And because birth it's vulnerable. It's really like a place where it's wild and things can go wrong, and women, I think I can speak for myself, like you have the little like movie in your mind of like, how's it going to play out, what's it going to be like. And I remember when I was first in labor, there was a real vulnerability about it. Like, am I doing this right? I don't know what I'm doing. Like, should I be naked? Should I not be naked? Like, I don't really like sitting on the toilet. I don't, you know, and you kind of lose your voice. But to pre-establish a friendship and a dynamic with that client in the safety and the cocoon of their own home, I think that speaks wonders, especially when a lot of them will be, you know, birthing in the hospital. That's beautiful. That is such a way of setting yourself and them up for success.
Well, Anastasia noticed this, and it's so you noticed how like there's a thing that happens with hospital birth where people will labor at home, and labor's going great, and then you do that hospital transition, and labor will kind of stall out for a bit, and then it takes a little bit to get back into its flow. And Anastasia actually noticed this way before I did. She goes, "Have you noticed?" Because we had a couple of really like legit stop and drop births. We had one delivery where we were 8 minutes from door to birth. And then we had one that was 7 minutes.
I thought it was 8 and 9, but whatever. It was
regardless. She was like
10
legit stop and drop births. And I was like, what is happening with these? And she goes, have you not noticed? Everyone's labor is just progressing. Like nobody's stalling out.
Yeah.
And I was like, why do you think that? She's like, you're like a goofball. How do you not notice this? And I'm like, what's happening? And she's like, you're staying with them the whole time, dude.
That's why. There's a comfort.
Staying at home because they knew you were come over. So we were all like, okay. And then
it's less of an energy shift.
There isn't.
Yes.
Yeah, there isn't as much.
So there's not that like stall out. We got to reframe, get back into the labor mindset. Okay, now we're in this new place. It's just like, okay, now we're going. We're all here together. We're still all here together. Great. Now we're just going to keep going.
Yeah.
Wow.
Yeah. That's amazing. I remember getting to the hospital of a past birth when I was like birthing at Cedars, and it was my like first hospital birth. And I remember getting there and feeling a little like silly. Like, was I supposed to call my doctor on the way? But I don't even have my doctor's phone number. So do I like call the call service and then they like page him, or like do I just tell them at the hospital? And I'm like, why did I ask that question beforehand? Like, what was I thinking? And then, we get there to the desk and it's in the back of my mind, but I'm in labor, right? So I'm like, I am thinking about it. And the nurse behind the desk is like, have you called your doctor? And I was like, no, I don't have his number. Do you? And she was like, yeah.
That feeling of
yes.
like, oh my gosh, am I doing something wrong?
Yeah.
Am I where I'm supposed to be? And then like what you said, like, should I be naked? I'm sitting on the toilet, like in front of people. Is this right?
Yeah.
Like that feeling is so ingrained in us as women. Like,
yes.
I feel like I'm not doing this right. And it's like,
yes.
I want one of my like serious goals with the kind of care I'm giving now is just to be like, dude, that's my job. Don't worry about it. Like you will never be alone. Don't worry about anything. I will be with you. I'll be there at the security desk with you. Don't even worry about it. You have nothing to worry about. Like, you're never going to be in the wrong place. Yeah. So don't worry about where you have to go or where you have to be. No one else is going to check your cervix or touch you. And like, don't worry about being naked. It's not going to be a big deal.
Yeah.
But that thing about like being naked and like being on the toilet and stuff is like so ingrained in us from such an early age because we like get potty trained and it's we, and
it's not, it's not even that, it's vulnerable. So like, there are people I'll go pee in front of, but like, I don't want to go pee in front of a stranger.
Totally.
Like,
totally.
Right? Like the stage fright thing where you're like,
yeah,
I can't, but when you know someone, then, and there's that rapport there.
Yeah.
And you can, but it's the same thing for having a baby. Like you have to open up.
Yeah.
And be soft to have a baby. But if you, like, the energy isn't working in the room, then you're not going to be soft.
Even the simple thing of like, oh, shoot, did I make a call? I wasn't, like, did I not make the call I was supposed to make? Shoot. Like,
exactly. That's right. Like thinking about that stuff on the way over and how that like affects you. My daughter, Esme, Teresa, like multiple times when Dr. Melissa would come over, Esme would be like, so what are you doing here? You guys are just talking. And it was
baffled by what my job is. Esme has no idea what either Anastasia or I do.
She's like, for 5 seconds, listen to this baby. What's going on?
What is she here? And she has that hilarious little girl bluntness.
Yeah,
the bluntness is so good.
She's so blunt. Because the last time,
why are you guys here?
She goes, again, what are you doing here? I was like, Esme.
My favorite thing about her.
We're chatting. We're having a conversation where like just, you know, like I don't know. We're just talking. We're friends.
Oh, it's so cute.
I was like, when you were saying earlier that, you know, you're like, oh, I'm going to sit and I'm going to chat with my patients. I'm like, yeah, that's what happens. And then their kids are like, what's going on here? Who is this person?
Oh my God.
Pet our dog? What's happening?
Oh my God.
You love our dog, don't you?
I really do.
Well, our episode that Sarah told about her birth, we had lots of people asking questions, like more about it. And so that's also one of the reasons we're like, we've got to get the girls on, because we want to I want to just hear from your perspective kind of more about that experience with Sarah, and hear more about shoulder dystocia and all the things that led up to the decisions that you made. Because I know that when my midwives watched the video, they were like, wow, that's like, you know, really got the heart racing. But also then we talked about it afterwards, like that is the sort of situation where it's like, is she going to end up in an emergency cesarean section? Does that often happen with shoulder dystocia patients? And how were you able to advocate and like be so calm in that situation? I just want to hear about it from your perspective.
Yeah. So, I mean, with how big Sarah's babies are, it was in my mind that was a risk. Because Sarah has a history of making really big babies. Like Sarah has a history of big babes.
Yes.
You know, like, so that's one of the things that, you know, is a risk factor for shoulder dystocia. And it's, you know, there are certain weight cutoffs for that risk factor, where a physician may counsel a person for a primary cesarean section, like considering, like, do not even consider laboring, think about doing a C-section.
And how do they know the weight of the baby though?
So if you're doing an ultrasound in the third trimester and it's projecting a birth weight, for a diabetic person, if you're projecting a birth weight in the third trimester of over 4,500 grams,
which is how many pounds?
Which is, oh God, don't put me on the spot.
Do you want me? I'll
do the math.
Keep talking. I'll look it up.
So for a diabetic person, is over 4,500 grams. So that's 4.5 kilos. And for a non-diabetic person, it's 5,000 grams. So that's 5 kilos. And so that one is over 11 pounds.
Yeah.
When we have ultrasounds that are estimating birth weights that are that size, that's when, you know, there's a recommendation that, you know, physicians should offer a primary cesarean section to patients like that. And to me, that's the operative term there is offer.
Yeah.
It's not mandate. It's not push. It's not recommend. It's like, have the discussion about what the risks are and offer. Yeah. Because, you know, you should talk about what the risks, you know, what it means. Like, what is a dystocia? What does it mean, et cetera? Now Sarah's had big babes before and had them well. Like, Sarah has a pelvis that can, like, have a big baby.
Yes. We call it the unicorn vagina.
So, it's, you know, but the thing about these ultrasounds in the third trimester is they can be really off by a lot is the problem. Yeah. So they're not foolproof. They can be off by more than a pound in either direction. So say you have an ultrasound that's saying this person's going to have a giant baby. They may, you know, after the discussion of these risks, opt for a primary cesarean section, and then the baby comes out and the baby's less than 8 pounds.
Oh, yeah. That's happened to a girlfriend of mine.
You know, and that's been known to happen, you know, not infrequently. And the other thing is, there's a study out there about specifically counseling people on these risks. And, you know, it's not blinded. Once you tell people about the risks, they are more likely to opt for cesarean section.
Yeah.
Because, you know, we are not a risk tolerant society. So it's sort of an interesting question. But so I, you know, it was in the back of my mind for Sarah that it was a risk. And so look who it is. There's our little troublemaker.
Hi, Ocean.
Hey,
Aww.
Ocean. I remember you.
I remember you well.
She had some major tears just then.
Oh.
You're okay.
Oh, you can hear her little.
Oh my goodness. Drink away. Okay. Yeah, she's a big 5-week-old right now.
She's a big baby, man.
Yeah.
She does not look like my 5-week-old babies. I have minute, tiny little itty bitties, which, by the way, because I had some friends be like, how did you feel like listening to Sarah's birth story? You know, you're pregnant and everything. And I was like, well, I also don't have really big babies. So I was able to separate my own experience from that. But you were so amazing in her birth, and just like watching you in action was so incredible. Did you ever reach a point of like, oh my God, this is like a full proper emergency? Or did you, because you just seemed very calm?
So there's a point where, so there's an interesting sort of thought process where, like, if you know what you're going to do, it's never an emergency.
Yeah.
But there's always also the thought process that I have where I'm sort of the captain of the emotions of the room, specifically among the staff. And it's very much my job to make sure that all the staff remains calm. And so if they see, like, it's specifically my job to be like, I'm in charge and everything's fine. Do you know what I'm saying?
So you could tell.
So I certainly never felt panicked. But it's also very much my job to project that calm so that all the staff is like, someone's in charge, someone's the captain here. So it clearly is an emergency because, like, shoulder dystocia is always an emergency. It's like considered among birth workers like one of the most feared emergencies in vaginal delivery, actually.
Wow, really?
So, like, more so than hemorrhage, more so than other stuff, because it's this moment of like half birth where like the head's out, the shoulders won't come, you know? With Sarah's birth, though, there was never a moment where I was like, this isn't going to work. I never had that feeling, because what I specifically felt was that Sarah's pelvis would flex. So the thing that you need when you're resolving a shoulder dystocia is you need to feel that the mother's joints are flexing and that there's movement. So 2 key factors there are that, number one, that you can get your hands inside, and I could.
You could, yeah.
Sorry again about that.
Honestly, I didn't know. It's fine. It's great.
But also that the mom has a pelvis that flexes.
Wow.
And that's common to pretty much every woman at term, is that all of the joints in the pelvis will move. Like, the pelvis has, you know, the pubic symphysis joint, the sacroiliac joints. It's got all of these flexy joints. And as a non-pregnant person, mine don't flex that much. But as a pregnant woman in the 3rd trimester, they're like,
wow.
Yeah. And the maneuvers that we do to resolve a shoulder dystocia specifically rely on those joints moving.
Wow.
The bummer of what happened with Sarah was she delivered in hands and knees.
Yeah.
And so when Ocean's head came out, she was already in one of the positions that we do to resolve shoulder dystocia. Did the midwives?
Was that the gasket? That was the gasket maneuver.
Did the midwives talk about that?
Yes, they said, oh, she just did the Mick Roberts or the Roberts maneuver or something with the leg pump and the flip around from the gasket into on the back and and then you did that amazing leg crank thing.
So the leg crank thing is not something I was ever taught, but it just is something that like makes sense to me.
That was amazing. Like, that was my favorite bit.
She had her popcorn and she was eating it and she was like, I love this part.
My favorite part.
Oh my God, the leg crank. So that's that's like your little ism.
Maybe other people do it. Maybe other people do it too, but I wasn't specifically taught that one. It doesn't have a term as far as I know. But part of so there's 2 things that are super key.
It's the Drake crank.
Shoulder dystocia.
Oh my gosh, yes.
The other thing I talked about, like the flexibility of the pelvis. The other thing that's super key is making sure that everybody's really working as a team. So you probably also heard me going like, all right, everybody stop.
Yes.
Everybody breathe. I think I said everybody breathe. I don't know if I said that.
You did. I heard all of those commands. I was like, I think she's talking to me too.
Yeah, I was. You were the key on the team.
Yeah.
So the whole idea of like doing the leg crank is twofold. So, well, it's actually, I suppose, threefold because the baby's also key on the team. One of the things that happens when that shoulder gets really impacted, if you feel on your own shoulder, you have like this little notch right here.
Yeah.
This gets stuck under the pubic. This little notch can get stuck under the pubic symphysis. And with all of the forces that are going on with a shoulder dystocia, this can get stuck worse and worse. So like the maternal expulsive force, the suprapubic pressure, everything can actually make the dystocia initially worse.
Wow.
So with the leg crank, what it does is you bring the legs really straight. What it does is it actually straightens the shoulders out like that. And it makes everybody in the room pause for a sec because it usually wigs everybody out too. Because they're like, why are you asking me to do that? Nobody else does that.
Yeah.
So everybody goes, okay, fine, we're going to do that. And then you go back into your McRoberts, which is that position where you bring the thighs really far back. And the point is really the thighs. It's not even the feet. You want your thighs really far back and you really want your butt actually to come off the bed.
Oh, yeah.
Because what you're trying to do is you're trying to like flatten your sacrum out. And then specifically everybody who is involved in creating forces, mom, nurses, everybody, and me, if I'm doing something, needs to act completely in unison.
Yeah.
If everybody's doing something all differently, then the physics doesn't work.
Yeah.
So like me being like, all right, everybody stop, everybody breathe, everybody push, is like, it just gets the whole team to kind of work as a single unit. And you did so well. Like you were so amazing with it.
So it was so
just like
great,
so brave, and it was amazing.
And the two nurses with the like locked straight arms, pushing like one at the top of the belly, one on the pelvis. That was unbelievable. I mean, your team
at the top of the belly. Was anybody at the top?
Yeah, there was someone up in this position here, and then someone on the pelvis as well. In the video.
Not our main house.
Okay.
Your because we can't really say their name. So your main one was doing the pelvic.
The other part. Yeah.
You know who I'm talking about when I say the main one.
Yeah.
Okay.
Yeah.
the regular.
Is that really that suprapubic pressure? And because what you're doing is you're putting pressure on the back of that impacted shoulder to bring the baby's shoulders together.
Yes.
To see if they can sort of fold a little bit in half and come under the pubic bone. And then the other thing that I'm doing at the same time is putting my hand inside.
Yeah.
And there's an old mnemonic where we're taught how to run sort of through this algorithm of how to handle shoulder dystocia. It's like, start with the McRoberts, do the suprapubic pressure. And then you do a Rubin maneuver and a wood screw. And those are maneuvers where you like push on the back of the baby's shoulder from the top, push on the front of the baby's shoulder from the bottom. I don't follow that mnemonic because those actually can worsen the risk of brachial plexus injury. And I've found through my practice that actually one of the best maneuvers is just to go for what's called the posterior arm delivery. And that's where if say the baby's right shoulder is impacted, and that's the one that's stuck under the pubic bone, then the left arm is going to be the one that's on the bottom side, sort of like closer to mom's rectum. If you can sweep your hand into the vagina and then bring that arm out and deliver that one, that protects the baby's neck. There's no traction in the baby's neck at all.
You did that.
You did that.
I saw her little arm come out.
We brought Ocean's arm out, and then she was able to come through. Now, usually they will shoot out when you do that.
No.
She's so big, she did not.
There was a lot of moments of that birth where we thought she was going to shoot out, right? There's a lot of moments where we were like, oh, now she's just going to come on out.
Babe, come on. She was... she's like one arm out, and then she's still so round and wide, even around this diameter. So she's still so round here that I still, then I had to yank her under this armpit, and I'm getting her. I'm like, dear Lord,
God.
Kid. Anyway.
And somehow didn't tear.
You have the platinum pellet.
That's what I said. I was like, it is a unicorn vagina. How did you not tear or graze or any? Like, I just don't understand.
I don't know.
But also, you're very gentle about it. So, like, let's. I've watched a lot of people.
Yeah.
I've watched a lot of different people, and the way that you go about it is different. So, and I think that you're thinking about that, and obviously, you can't always get away with it. Like, sometimes people tear, and if you're tearing because we're trying to get a baby out, then it happens. Yeah. But you are pretty good about trying to make sure that you're trying to avoid doing that when you do it. Okay, so when I was thinking about today, I had this reflection of something that you said, Sarah, and then something we intuitively kept talking about, and then not until she was born, and then for me to reflect later and be like, oh my gosh, I can't believe we all said this. So the two of us, which I think you knew, we were a little like, what is she doing in there? Like, she is in a funny position because you kept having contractions and dilating and and we're like, what is she doing? And I remember texting you when I think I need to go over to Sarah's house. I think I need to go over there and just wiggle her or something. And went over and we wiggled a little, and then I'm just
this is in the lead up to the labor.
Yes. Yeah, this is like before. Well before. And I'm just going
just like a week or two in advance.
Yeah, maybe even 2. And we just got going, gosh, what is she doing? What is what's happening in there? And then one day, Sarah, and I don't remember when this happened exactly, but it was before you were in labor, and you were just like, I keep telling her hands down, tuck your head. But her hand was next to her face.
Oh my God.
Yeah.
And I didn't think about it until you told us we're going to do the podcast. So then I was trying, I was just kind of going through things, and I'm like, oh, Sarah knew, but she didn't know she knew.
Yeah.
Yeah.
Wow.
You didn't know that you knew.
Yep.
But
I kept thinking in my head, and I told Teresa this too, but leading up to it, those last 5 weeks, there's always something. And I don't know if you feel this way with your patients, but there's always something that we get stuck on. Mm-hmm. There's always something that we think about where we're like, well, I'm really worried about this. I remember my first birth, I was worried about stillbirth because I didn't understand it. And so then I was asking my doula to explain it to me. And it's something that would pop into my mind a lot. Right. And so I think with every birth, there's something that comes up. Teresa has something right now, which she thinks about sometimes. And
sent to abruption.
Right.
Just it comes up.
But you read something or you see a story or whatever it is, and you're like, oh man, why did I watch that or read that or whatever? Now it's in my head and I don't understand it. So my brain's going to keep going, well, what about that? What about that? Right. But I think there's always something that kind of jumps back into your mind, whatever it is with each birth. And this time I kept thinking positioning. There's something about positioning because I've had positioning in the past that was a little wonky, and she was in a different position than my other kids because she was leaning on the left, whereas they were all on the right. And so I kept being like, oh, I really hope she maneuvers her body around though when it's time. And I kept thinking about it. And then when it got down to the last couple of weeks, I just kept being like, okay, put your hands by your side, your back to my belly, tuck your chin. This is how we're going to go. And I just kept trying to
any of it.
She didn't listen. She didn't listen to when she was supposed to come. She didn't listen to when I was like, you're coming on your dad's birthday. I was trying to write a manifest thing about it. Of course that didn't work. And I was like, Teresa can sneeze a manifestation and it comes true in 3 hours. Like, it's just insane. But for some reason, for me, I'm like writing and meditating and all the things, and like that doesn't happen. So I was like, oh, she's coming on the 31st, and she didn't come for what, another 20 days? I don't know. Yeah.
When did you name her?
Oh gosh, I named her
years ago,
a long time ago. Yeah, like 2 years ago.
The next baby was Ocean.
Because I'm like big on name meetings.
You're big on, yeah.
You named her Ocean. And you were trying to tame the ocean with the manifestation.
I know. It's
Ocean. Oh my God, it's so true.
Which is so like, she's the ocean. You just got to flow with her.
Yeah. That's so true, though. I think
really good point.
Either way.
Yes.
Flow with the ocean.
You gotta go with the flow. I mean, really, though, because we kept at every turn, even with the birth itself, like, do you want to, Anastasia, do you want to talk a little bit about how the birth was for you and like what your perspective was on it?
Yeah. I mean, you, and I asked you this afterwards, you were so beautiful in labor and you have such an amazing mindset. And I'm like, oh, can we like go teach it? Can you come to class with me and like teach everyone this? Because you would just be positive. Like even when things were hard, I knew it was hard. I knew you were working hard, but you were like, you would laugh like, and I'm like, what was funny? And you're like, I can't find a comfy spot. And I'm like, let's talk about it. Like, it was just so great. You just always had this like sweet, positive attitude about it. And that helps you to, flow with it. It was so beautiful. His shoulders for me are crazy too. And then also I don't want to say I don't have a job, but it feels like I don't have a job, like, because I can't do anything.
Yeah.
So I just have to stand there. And you talk about like, obviously we hold space all the time as doulas, but you're holding space and it's really intense. And so it's like a different kind of needing to hold space. But I also, because we work so well together, and can pretty much read each other's mind, before we were even there, I knew what was going to happen. So I wasn't going to say that out loud, but I already knew where we were going and what was happening and where people were going to go. And I have a really great relationship with a lot of those nurses, and the ones that were in the room were some of the ones that I'm particularly close to. Mm-hmm. So we didn't have to talk either, and just did a lot of, like moving or just like gentle touching, just like, okay, and knowing like, I need you to move a little bit this way and I'm going to move a little this way. And,
wow.
But there's a picture that you sent or that's in there, and I'm standing at the desk, and I don't know what anybody else sees when they see it, but I'm like, I see the inside of me, which is like, what do I do right now? Like, I just have to be here. Like, I can't even be next to you to hold you because all of these other people need to be there. So I don't even have the ability to like hold your hand or touch your leg. And that's like, as a doula, where your primary job is to like give comfort. That's probably the hardest part when a shoulder goes to where we went, which is I have to fully like physically move out of the way. And it's like where you like kind of need to twiddle your thumbs out of nervousness because you have nothing to do.
And the other bummer is, you're almost always on the opposite side of the bed than the husband, right? Than the partner?
I think that was chance.
But I'm picturing it. I feel like you almost always would be. No.
Sometimes I end up next to like dad. But
because I'm thinking like that's a position where you can at least be together with them.
Yeah.
And
CYA ended up over there because actually usually I'm on the other side. I'm on the side with the husband usually.
Yeah.
So I have to watch the video back probably and see why I ended up over there because I can't remember, but I think it was logistical. Like I was there and there wasn't moving happening.
Yeah.
Like I wasn't going to be able to I was going to get in the way if I was trying to move.
Yeah.
And have you seen this? Oh, sorry, Sarah, you go.
No, I was actually just going to ask, how has that come up before? Because, my cervix was swelling and you suggested the Benadryl. And is that something that has come up for you before? Like, that's not something that was offered to me in the past when I had a cervix that was swelling. And I remember, there was like different stages of different things that people felt a little panicky when that was happening, but you were very calm and you were like, I have this, here's what the next step can be, and you sort of like threw it out. So how did you get to that? And where was that something that you learned along the way, or is that like normal practice or?
Yeah, that's something I learned along the way. I don't remember quite where I picked that up.
I mean, even in the time we worked together, you picked it up. I think, I don't know where. I can't remember where. But what's interesting is that it's spread. It's not just you, because I had a different doctor at Cottage use it.
Interesting.
The other day. Good. I don't know if it was me or if it was like another doula was telling me or something. And I was like, yes, do the Benadryl. I mean, I remember the first time you and I used it together, and I was like, what is this magic?
It's magic.
Like, it
works.
Because I was like, let's grab some ice, and like, let's grab some ice.
Yeah.
The ice melts in your vagina.
The ice melts instantaneously in the vagina.
Yeah. It's hot in there. It's hot.
Like, I've tried like the ice in the glove thing.
Yeah.
It melts instantaneously. It's so frustrating. What are we doing here?
And so the Benadryl just takes the swelling out.
Yeah.
Wow.
Now, the problem with IV Benadryl is, even oral Benadryl makes people feel just kind of tired.
Yeah. I felt like my eyeball was falling down my face.
Sedative.
Do you remember? I was like, what's wrong with my eyeball?
Oh my gosh. IV Benadryl makes people feel wackadoo. So it makes people feel so loopy, so crazy. Sarah, you were saying it made you feel like what? Like your eyeballs were rolling down your face?
Like my eyeball was falling down my face, my right eye. I was like, oh, my eyeball, like something's wrong with my eyeball. And Eric was like, your eyeball is fine.
It's fine, babes. It's still there.
I was like, is it falling down? And he was like, it's not falling down. Your eyeball's fine.
So that's definitely not one I've heard before.
She's an anomaly, this one.
It's not on the list, at least, of known side effects in the package.
Okay, write it down. Just kidding.
I'm sure they can add it. But like sedation, like dry mouth, those kind of things. Blurry vision is like, those are classics. So I was definitely prepared for that. The eyeball thing was new.
Wow.
But I know I just felt you seemed so miserable on it. I felt so terrible that you felt so bad on it.
Oh, poor Sarah, and any sort of
it's
anything.
Just me and drugs.
I know.
Yeah.
Just drugs for her is tough.
Yeah, it always, there's always like a moment where I get a little freaked out about the idea of drugs, but that actually is a perfect moment that leads me to a question that I wanted to ask you. When I was in labor and we started to discuss the epidural, you actually explained what an epidural does in such a way that no one had really explained it before to me, or maybe it hit me for the first time, and I felt less afraid of it in that moment. It felt like a really important tool in our toolbox that I could utilize to be able to like stop that, very intense feeling of needing to push and pushing along with it, and be able to like allow everything to calm down a little bit. So can you tell us a little bit about what an epidural does in the body and why it can be a tool that can be used?
Yeah. I can't remember exactly what I said to you in the moment, so I hope that this is as good as it was in the moment.
I'm sure it will be.
So it's regional anesthesia. So in terms of like where it affects you, it does not get into your entire system in the way that medication that like goes through your IV would. So, for instance, the IV Benadryl hits you in the IV and you feel it. It gets into your bloodstream. It gets into your whole system feels it. You feel that crazy loopy feeling. You feel like your eyeball's going to roll down your face.
Yeah.
The way the epidural works is it's specifically affecting the nerves that it needs to affect. In terms of it being like, we call it an interaxial block. So because of specifically where it's placed, and this is why anesthesiologists are like the most popular guys in the hospital, guys and gals in the hospital. They can do these specific nerve blocks anywhere on the body. So they can block a nerve anywhere. They can block a nerve in your arm, in your hand, in your thigh, in your foot. What they're doing with an epidural for labor is they're doing a block specifically at the level where they're going to bathe the nerves below that level so that the nerves in the pelvis and on the perineum, so like uterus down lower than that and on perineum, receive pain relief. And then it's not crossing the blood-brain barrier. So because the medicine is going like into the epidural space and then bathing directly onto the nerves of the spinal cord, it's not getting into your bloodstream. It's not crossing that blood-brain barrier. It's not crossing the placental barrier. It's not, getting directly to babe. It's affecting the nerves it needs to directly and not moving past that. So
I think there's a misconception, like over the years I've heard too. It's like the epidural can affect your baby and the baby can come out drowsier. And, I remember hearing these stories and I'm like, I cannot ever rely on this. Like, don't ever rely on it. So it's good to hear it from an actual medical professional who can break it down in a way where it seems less scary.
Yeah, for sure.
Well, and we can talk about how it affects the baby because it can.
So the way that the epidural can affect the baby is that one of the things it definitely does is below that level where it's placed is it can drop your blood pressure. So that's the primary way that it can affect the babe. Yeah. But we prepare for that by giving people a big bolus of IV fluid before people receive the epidural. So that's why you can't just be like, I'd like the epidural, and they sort of bust right into the room and give it to you right there. You have to prepare for it by giving at least, and it's sort of different in every hospital in terms of like how much they want you to have, but usually at least 500 milliliters, sometimes 1,000 of IV fluid to really boost up your intravascular volume to prepare you for that drop in blood pressure that occurs when you get the epidural placed. Because it's almost universal that people will take at least a bit of a blood pressure dip. And from what I've seen, it usually affects the diastolic pressure more than the systolic. It will affect both, but the systolic will tend to recover and the diastolic will tend to lag. So say somebody had a blood pressure of 120/80 before the epidural. Right after placement, it may be like 90/50. And the babe...
That's where I sit at. I'm at 85/55.
So say you're in labor at 85/55. And then we give you an epidural and all the blood vessels below that level suddenly go whoop and dilate. You lose your blood pressure essentially below there. And you go from 85/55 to 70/30.
Yes, I see.
The placental bed needs a certain amount of blood pressure to get blood to that area to perfuse. And that lower number is particularly important. And so like usually what I've seen is a placenta does not appreciate a diastolic blood pressure that's less than 48. You will start to see a fetus show you decelerations when you're in those diastolics that are in the 40s. Not always, but I start to get a little bit like...
Would that mean someone who has chronic low blood pressure like me? Because every time I get it done, my midwife's like, Jesus, do you feel dizzy? I'm like, no. But does that mean that an epidural can be more risky for someone like me? Or you would, if you had a patient with very low blood pressure, you would know to give way more of the IV?
What we would do is we would just sort of anticipate it. We'd prepare for it. I would absolutely be like, we need to boost this person up with a ton of fluid. And then there's other medicines that you have kind of on standby to prepare. There's vasopressors that you can give to just, like really boost that blood pressure as much as you can from below. So
I'm so glad you're explaining this.
I know, right? It's fascinating. And I feel like there are a lot of misconceptions out there in terms of, I know that there's people who have different, like not side effects, but an epidural will affect them differently. And it was kind of by chance that I had like such a successful one. And you guys also were like maneuvering my body in a certain way to where it hit where it needed to hit. You had the bed placed at a certain angle, and like everybody was just on their A game. And also one of you, I can't remember which one of you, told me that there's also a little bit of chance at play where like when you do an epidural, that it's going all to the right place and that everything is happening the way that you're wanting it to happen. And I just had a really successful one where it was like, okay, this is doing what we needed to do in this moment. It ended up being such a great tool for what we needed, right?
Yeah.
And I think both of us explain it as like, with all these like myths that are out there, like, look, the epidural is a big gun tool. It's not like it's not a small tool. It's big. And there's other risks that have nothing to do with it, which is like lack of movement. But I always tell people it's not black and white too. It's gray. So
right.
if we're talking about it, we're talking about what are we using it for? When are we using it? Are you getting it when you're 1 centimeter dilated? Okay, we're having a completely different discussion than getting it because you're struggling to not push on a swollen cervix. Those are two very different discussions because you're using the tool in two very different ways. And so the risk benefit conversation is different. And I think that's what you and I really try to do with people is like, hey, let's not put this in a box. Let's talk about what's actually happening in front of us and how do we use this wisely if we're going to use it.
Yeah.
I can't imagine Sarah being able to do what she did without an epidural. Like all the stuff that was happening with having to, like even just having the hands in there and trying to get the shoulder out. Like I can't imagine how, and actually Eric said that in our birth video too, in our birth episode as well. He said, like there's just no way that this would have unfolded in the way it did without like having that relief. That was, Yeah,
I remember him saying after the fact, he was like, that was wild. I just can't imagine what it would have been like without it. And I don't know a lot of times in my life where I've ever asked for help, where I've actually said like, I need help. But this was, and I'm so glad that we discussed the birth on the podcast because the amount of responses that I got after I explained what it felt like to push and have no progression, like feeling like I was pushing against instead of pushing through, and how there were people who were like, oh my gosh, that's exactly what it felt like for me. I wasn't having any progression. I did feel like I was pushing against and not through. And I have to say that like once that relief of the fetal ejection, is that what you call it? The fetal, that's what I kept calling it. Okay. Fetal ejection. The relief of that. And then it didn't feel like I needed to. There's like nothing you could do. I tried everything. I was like breathing through, thinking about something different. Okay, I'm going to try this. We're going to hold on to that. I'm going to take some deeper breaths, faster breaths, smaller breaths, like whatever it was. I mean, I had 30 minutes every 90 seconds to practice all these different ways to go through that, right? And it was like, nothing was working to stop myself from pushing in that moment. I'd get all the way to the peak and I'm like, I'm almost there. Okay, I'm still pushing. And it was so wild. But that was the moment when I was just like, I need help, and I was so grateful that was there and that you had explained it in the way that you did. And Anastasia, that was such a great explanation of when to use that tool or like that, or what kind of a tool that is. Before we jump off, I just have one more question for you. And that is for all the new moms out there that are listening to our podcast. Maybe it's their first time, and they're pregnant and they're so curious about birth. If someone is really wanting to have a physiological birth, with no intervention, but they're doing it at a hospital, or maybe they're having a midwife, do you have any suggestions for them as they're going through their pregnancy? Like, these are things that you could be doing, or this is how you can set yourself up for success. Is there anything that's your like go-to thing that you could say to someone who's like, I think I want to have a physiological birth and I'm scared, but like, give me something.
Remember,
Who's going first?
You go first.
Either one of you, whoever.
Funny enough, I just had this conversation 2 days ago.
Oh, perfect.
Yeah. She sat and looked at me and she was like, I just know I don't want a lot of intervention, but I don't know anything.
Yeah.
Tell me. And what I told her and what I think I really try to instill in everyone who it's their first time is, you were created for this. Like you were designed for this, and you need people to hold like a safety net for you and to be there. But most of the time you're okay.
Yeah.
And I tell moms what I want you to walk away from your birth is that you learn how to listen to your intuition and trust it, because you're going to carry that for the rest of your life. And it's the most important thing for you to learn how to trust. And so I'm always putting it back on moms. Like, how does that make you feel? Does this feel like the right choice here? Not me. Like, for you, does this feel like the right choice here? Because it's funny that you had just made that comment about all these women writing you back and saying, like, that's how I felt. That's how I felt. To me, that's a testimony of we need to listen to women.
Yeah.
We need to listen when they tell us what they're feeling on the inside, because they're telling us the truth. And my philosophy has always been, I might need to try to figure out what's going on because you can't quite put words to it, but whatever you're telling me is the truth. So I just need to figure out, how do I help you with the words that you're giving me, but you aren't lying to me. Something's going on and you know what you're feeling. It doesn't have to be your fourth baby. It can be your first.
Right.
So
wow.
That's
so beautiful.
And what about you, Dr. Drake?
I was just going to say, because birth is both a physical and a mental game. Mm-hmm. So I tell people, like, you have to prepare yourself physically. Yeah. It's such a physical act. It's right. Such hard work. So stay physically fit throughout pregnancy, like move your body. Like my friend Jessica Thrift, who was the nurse midwife that worked with me in the office, had this hilarious advice. We would we'd be running around the office and then periodically we'd like come together, and I kept this little list of quotes for her. And she's like, man, it's just not that hard, man. Move your body, feed it, rest it. That's just all there is, man. And I'm like, it's fantastic advice. But just like move your body as much as you can throughout pregnancy, as much as you can in a way that like feels good to you. So like move your body, feed it, rest it. But just like know that it's physical. So like just be ready for it to be physical, because it is. Mm-hmm. And then in terms of like mental preparation, I really always want people, it's such a shame, and I talk about this a lot, that we've taken birth from being this like community event to making it be this like completely solo event. And it has really robbed women. It has been in my opinion, like one of the most key things that has taken the power of women away. We have been so separated from our power in that way. By your early 20s, 100 years ago, you would have seen at least 5 births, perhaps. Yes. By the time at least you came to your first birth, you should have seen many births already, because birth used to be a community event. Yes. You would have seen siblings be born. You would have seen community members be born. It used to be a thing where all the women of the community would come together and support each other and celebrate each other. And now it's this thing where it's completely solo. It's super medical. It's super private. It's very secretive. Yeah. And one of the ways that I think women should mentally prepare themselves is read birth stories. Yep. Positive birth stories. When I say read birth stories, I mean like read Ina May's Guide to Childbirth. Read,
it's the best,
because like, those always include like positive, healthy birth stories. Yeah. Read about positive birth. Like what you don't need to hear is everybody's nightmare birth stories that everyone seems to tell you when you're pregnant. Right. You need to hear about like positive, healthy birth stories. And you need to do the kind of things that are going to help you just sort of like get into your animal brain, get out of your thinky brain, and sort of start to unlearn the fear that like the modern world has just really instilled in us as women so much. So that's
I always birth with the sisterhood. I usually have like 4 or 5 friends around me at birth. And they all play a different role. They're all like, someone's giving me ice. My husband like sat out in like, he was in the room, but I was in the shower. And I remember looking at the faces of my 4 best friends. And each of them were like giving me sips of coconut water. Someone was bringing me like smelling salts, and someone, we were all kind of dancing together. And I was like, oh my God, this is how I like to birth.
Yeah.
I like to birth in my sisterhood around me. It's really cool.
Which is so special. And I think you were talking about mindset earlier. That mindset is such a big part of it too. It's like what your intention is and what you want out of this birth, like setting that intention and thinking about it. And, you were talking about my mindset in this birth that I had, but I really wanted to feel joy and happiness as I was like in it. I know it's hard. I know that when the, big waves come towards the end, that it's hard, and you can meet it with, or you can meet it with like, I can't get comfortable. Like this is, this is crazy, and it's like, if you're allowing your body to see that in between each one of those and, kind of laugh through it, then it does change the way that you meet each one of those rushes, right? Which is it's an amazing thing that you can trick your mind a little bit like that, to not be like, every time, And anyway.
Fear more than laughter. Like laughter is absolutely the best.
Yeah. I love it.
So true. And nothing that makes you feel more held than someone wiping your poo off someone else's shoe. So thank you for that, Anastasia.
So well done.
My very raw bum.
Oh God.
Well, thank you guys so much for coming on our show. This is just incredible. And I know there's going to be so many things that people are going to take away from this. That's just going to be so special for them. We loved having you, and I love you both dearly. And just like see you both as friends, and I'm so grateful for that, and for you guys showing up for me in this wild time in our lives. So
thank you so much, you guys. So inspiring.
We love you. Thank you for having us.
Love you. Thank you. And you guys have been listening to the Mother Daze podcast. You can find us on Apple Podcasts, Spotify, or wherever you get your podcasts. Bye, Daisy.
Bye.